Happy 420, everybody. It's Cheech and Chong here, ready to do the April 20th episode of Health Tech Deals.
So Jessica, smoking weed live on HTD is not to be encouraged. So that's why when you're not doing it. Plus, it's kind of early in the morning.
No, that's why I took an edible, Matthew Holt.
Well, let's see if it cuts in before the end of the show. I'll see if I can tell.
No, I really need some because I'm moving. This is the last episode we're going to do of Health Tech Deals while I'm here in this house.
You're leaving, you're moving, you're selling Florida and running away to Costa Rica right here is the next move.
Yes, that's where I'm going next.
Well, we're all excited to find out what happens next. There may be more news in the Jess and I
moment.
Yeah, we'll hear. Well, I'm looking forward to hearing more about it later, and whether there's any sailing in the future or something. Anyway, all right, we got a quick show today. Not a lot going on, but
chilled out funding news because hey, 420. I mean, hitting people hard.
That may be the reason. I don't know if it is or it isn't, but whichever way, we've put a group together. So let's do it.
Let's do it. All right, Carbon Health, getting into diabetes care. Matthew Holt, explain what's going on here because there's quite a bit of a story behind it.
Yeah, so Carbon has been growing like a weed, right? Basically did urgent care clinics. It did an amazing amount of testing and vaccinations and made a lot of money out of it during COVID. Meanwhile, it's been converted those urgent care clinics into GP offices. It's about half of them. I think they have, I don't know how many, they're on the way to 100. About half of them now are also primary care practices. I actually met some people who have them as their primary care doctor. They bought a company called Steady MD, which is kind of a bit like Gluco, a bit like Livongo, manages diabetes care. And now they're generally announced, that was bought last year. Now they're generally announcing that for their own clinics. So I think they're now basically trying to figure out how they go after like the bigger primary care groups like One Medical and Iora and Oak Street and all the rest of it. And we'll see how they go. They've raised a lot of money, something in the 500 million range, and they're growing fast like a weed. So yeah, very interesting. Plus, they also announced their costs.
Weed, that was hilarious. All right.
Got the weed in there. All right, go on.
Clipboard Health announces 2 rounds, because why not? They raised $50 million last year. IVP led that one, and now they're talking about a $30 million round that Sequoia led. What is
about 90 million overall. Yet another different nurse staffing app. This one apparently has a 1.3 billion valuation. You know, ConnectRN, Trusted Health, ShiftMed, Nomad, Incredible Health, IntelliCare, CareRev have all raised somewhere between 30 and 200 million. They're like must have like 5 or 6 nurses each on their platforms. God, I don't know.
Interesting. So this one, $3 million. This is a Zeus competitor called Source Health. Interesting who invested in this. Talk about that.
Yeah, this is a bunch of ex-Roe folks starting it. Roe apparently is going to be a client, and I think Ziritano, as well as first round, is one of the investors. Scheduling, interesting. We'll see. Is there another room for another one of these things putting together? I don't know.
All right, Tiger leading a round with a bunch of others in it for Diligent Robotics. They get 30 million in a B, brings their total up to 50.
Yeah, this is one of those robots. So there's a thing called the Atheon Tug, which has been in hospitals for a long time, which is like a machine that moves big stuff around, like it's literally a tugging robot, like a that moves. That's been in the hospitals for a long time. This is kind of trending to be more like a humanoid that's going to wander around bringing supplies. Got this one in there because it's interesting because hospitals have incredible labor shortage, as we've heard many, many times. And the reason why Clipboard and God knows all these other companies, are doing nurse staffing. And the more you can get humanoid type robots to do, like bringing supplies and moving stuff around, the better. So I think that this is indicative of a big trend within the inpatient facility. How big and how fast, I don't know, and how well it works. But I think more and more stuff will be done by robots.
Okay. Look forward to that.
Your robot overlords will take over, but first they're going to bring you surgical supplies and other stuff.
Jello cup.
Yeah. No, it's a bit of a slow week. What there was not a deal, but somebody closed down, right?
Yes, a head has fallen behind. In fact, they've just fallen off completely.
The head was chopped off. It was actually chopped off. Right? This is
what happened?
Yeah, this is the Cerebral competitor. I mean, Cerebral's been growing so fast doing his ADHD meds. It was a competitor to them. There's a lot of advertising on Instagram and what have you. They were actually funded by TruePill, which is in the background doing all the pharmacy fulfillment for a bunch of people, including Cerebral. And they obviously decided it was either not worth the effort, not growing fast enough, or too competitive, and they wanted to get out of the business of competing with one of their customers. But you're going to see a lot more of people as the market slows down. All these little companies that didn't quite make it for whatever reason. It's not the first one we're going to hear that's shut down in the next little bit. I think we're heading into a bit of a lull.
Okay.
Hopefully, we're still in business by the time this all goes on. Hopefully, there's still a deal show. Which is if the deals are all that someone's closing down, it's probably not as good a deal show as it might have been.
Well, maybe it's not a deal show. Maybe we can have people on and they can talk about what happened.
You have 2 minutes to explain what went wrong.
You have 2 minutes to explain what went wrong. I love that.
All right. So what's going wrong is that you're selling your house, you're moving out, and you're going to Costa Rica.
Yeah, that's the short of it.
How long are you going to Costa Rica for?
A week.
Okay, that's not really retiring in Costa Rica. That's just like a Pilates trip, right?
Well, let's hope so.
And then you're going to reappear, I hear, in early May.
I'm reappearing at ATA's annual meeting, the American Telehealth Association conference, which is May 1st through 3rd in beautiful Boston.
And who are you talking to that?
Right to know from Ro. I'm main stage firesiding him on Monday morning.
You're going to set Z on fire.
Yeah,
he's a smart guy. I had him.
He's awesome. We did our prep call. I was so fired up after I got off the phone with him. So fired up.
You didn't see him on the one I did with him at What's Next Healthcare?
Of course I did, but it's been a while, and I just
you forgot.
My fire for Z was reignited. Let's just say
your Z fire is reignited. That all sounds.
No, it's so cool what they're building over there at Row. Like they really have.
They probably took a good move by not going public and taking that money, and they're building out all the different parts of the sort of the primary care, front door to the primary care stuff there. I think interesting that Carbon's not doing a massively similar approach, and Carbon has been cutting a bunch of deals from back to Carbon with hospital systems, kind of like the way One Medical does, which enables One Medical to charge a lot more money. Carbon's a lot cheaper, and they publish their prices. So I want to.
Well, that's the thing with Row is like they're incredibly cheap. Like I had no idea that they had this like $5 generic pharmacy that they're running out of there. And that's just one piece of like all these different pieces that they put together to like really strip out cost. And Z's whole thesis is that this direct to patient care model is going to be the way healthcare works in the future. And like our whole chat is going to be about how we get from where we are today to that. And it's
let me give you one.
I like this.
Yeah, let me give you one fun data point. So finally,
just one, but usually you have so many fun data points.
Okay. I have been complaining about Brightline and having and having to go to CVS to get my daughter's ADHD meds for months after months after months. Finally, I found out that Alto Pharmacy will deliver controlled meds, and I had them deliver last night. Came to my door, no waiting around, fantastic, same cost. To me, as it was.
How long of a supply? Because one of the things
it's still just 30 days. You can only use 30 days for a control med.
Got it, okay.
But so I asked the guy, I was going, how can they possibly afford to deliver me, $60 worth of medication driving all the way from San Francisco? He had 25 stops on his route.
Yeah.
So
worth it.
He's doing a lot of delivery. One guy with a car, like an Uber driver for several hours.
Oh, hey, doesn't it sound like Sprinter Health's model of doing a whole bunch of layouts?
Yeah, it didn't have to come into the house. Didn't have to come into the house and spend any time with me. Yeah.
We love when that model is applied to things that make your life easier.
I didn't have to pay an extra $90 to get something that I would have got. It was the same price to me.
No, but Z was talking about those economics around the pharmacy delivery, and even like just extending like the amount of. Like he used an example with me just in conversation about Crestor, and it's like you can only usually get it for 6 months that your plan will pay for, and you can order direct from them for a year. And it's like think of just even the packaging that you don't, and the shipping you don't have to pay for, and all of that. And it's like plus the middleman that you've cut out. So interesting, this direct patient care model. I can't wait to talk to him on stage. It'll be fun.
All right, welcome. Okay, have great fun in Costa Rica. We will see. I may have, if there's enough stuff going on next week, I may have to find a substitute for you.
Either that or I can do this with like a howler monkey behind me or something.
Okay. We will touch base while you're in the jungle on the beach.
To keep in contact with me on Twitter, head on over and follow at Jess DaMassa. And he is, of course, at Bolty Boy. All of his hijinks and complaints about different health tech startups and praise for other ones can be found there. And to never miss an episode of Health Tech Deals or any of the other great content from the blog, head on over to thehealthcareblog.com and subscribe for our email newsletter, which goes out whenever we damn well feel like putting it out there.
Hey, bye. Have fun.
Happy 420. Bye.